What would you do if your face suddenly felt numb, your arm weakened, and your words came out jumbled while you were completely alone? It's a frightening thought, but for millions of older adults who live by themselves, it's a real risk. Every 40 seconds, someone in America has a stroke. And many of them happen at home, with no one around to notice the signs or call for help. That's what makes strokes so dangerous. They don't wait until someone's nearby. They strike silently in your kitchen, your bathroom, even while watching television. And when they do, time becomes your most valuable resource. With each passing minute, your brain loses precious cells, and with them, your ability to speak, walk, think, or even survive. The problem is, most stroke advice assumes someone else is there to help. But what if the only person there is you? The truth is, you can survive a stroke alone if you act fast. And to do that, you need a plan. You need to recognize the symptoms, call for help in creative ways, prepare your surroundings for rescue, and take small steps to protect your brain while waiting. In this video, I'm going to walk you through 5 life-saving actions you can take if a stroke ever strikes when you're alone. These steps are simple, practical, and proven to make a real difference. Because being alone doesn't mean being helpless, and what you do in the first 5 minutes could determine how the next 5 years of your life unfold. Let's begin with the first and most urgent step, knowing the signs before it's too late. Most people imagine a stroke as something dramatic, a sudden collapse, a slurred scream for help, someone fainting in public. But when it happens to you, it can feel far more quiet, more confusing, even dismissible. You might look in the mirror and notice that your smile feels lopsided. You try to lift your arms, and one just doesn't stay up. You say a simple sentence, something easy, like, "The sky is blue today," but the words come out wrong, or not at all. It's subtle, but something feels off. Deep down, you know. This is where most people lose precious time. They wait, they rationalize, they convince themselves it's nothing. Maybe I'm just tired, they think. Or, I must have slept funny on my arm. Some even take a nap hoping it'll pass. But strokes rarely get better on their own. And every minute you delay, your brain is fighting to survive without oxygen. That's why recognizing the signs, right in that moment, could save your life. There's a tool doctors use to help identify strokes quickly. It's called FAST. F for face. Does one side droop when you smile? A for arms. Does one drift down when you try to lift both? S for speech. Are your words slurred or strange? And T for time. Because if the answer is yes to any of those, time is not your friend. Now, when you're alone, no one else is going to perform this test for you. You have to be the one to notice. You have to be the one to act. That's why I recommend keeping a mirror nearby or knowing how to use your phone's front camera. These small habits can become lifesavers when seconds matter. But there's more. Not every stroke looks the same. Sometimes it's sudden dizziness, trouble seeing out of one or both eyes, confusion that sneaks in like a fog, or a headache that feels different, sharper, more intense than anything you've known before. Even if you're unsure, even if you think, maybe this is nothing, I need you to treat it like something. Because in stroke care, the difference between full recovery and lifelong disability often comes down to one decision: the decision to act or to wait. And so if you ever feel that something isn't right, don't argue with your instincts. Don't wait for it to pass. Your brain doesn't have time for second guesses. Recognizing the signs is step 1. And once you do, the next step is to get help fast, even if your voice won't cooperate. That's where we're going next. Once you realize you're having a stroke, your next move is simple but critical. Call for help. And yet, when your speech is slurred, your hand won't move, or your mind feels foggy, even this one step can feel impossible. But you must try. You must act, even if every part of you is working against it. If you can speak, say one word clearly: stroke. That alone is often enough for emergency dispatchers to understand the urgency. They're trained to recognize stroke symptoms even through broken speech, silence, or confusion. If your words fail you, don't hang up. Stay on the line. Many 911 systems can trace your location even if you say nothing at all. If your fingers won't type or dial, don't panic. Use voice commands. Your phone may recognize "Hey Siri" or "OK Google," call 911. And many modern phones have an emergency shortcut pressing the power button 5 times quickly or holding down both volume and side buttons together. It's worth checking how your phone works today, so your future self doesn't have to guess. If you have a medical alert button, wear it, use it, and if you live in a smart home, Alexa or Google Home can be told to call for help too. The goal isn't just to call, it's to connect. And even with impaired speech or weakness, there are still ways to do that. But if none of that works, if you're unable to reach a phone or device, make noise, bang on the floor, yell for help. Neighbors can be more powerful than you think, especially in apartments or shared housing. Let the world know something is wrong. And once you're connected with help, give them what they need. Tell them you think you're having a stroke. Share your address slowly if you can. Let them know if your door is locked or where you are in the house. If speech is failing, speak what you can. Even single words like locked, stroke, back room. This may be one of the hardest calls you ever have to make. But it's also one of the most important. Because when you call 911, you don't just ask for help. You activate an entire team trained to act fast, to bring the right tools, and to take you straight to a stroke-ready hospital. You're not just calling an ambulance. You're opening a door to survive and to recover. And once help is on the way, your job isn't over. There's one more thing you must do next to make sure they can reach you in time. Once you've called for help, the clock doesn't stop ticking. In fact, what happens in the next few minutes could either speed up rescue or slow it down when time matters most. That's why the next step is this. Make sure emergency responders can find you, reach you, and get to work without delay. The first and simplest thing you can do is unlock your door. It might seem obvious, but in the middle of a stroke, when your body is weak and your mind is foggy, it's easy to overlook. A locked door could cost paramedics several minutes. In some cases, they may even have to break it down, which takes time and could delay treatment. If you live in a building with a main entrance or security gate, and you're still able to move safely, try to get closer to that entry point. Make it easier for responders to hear or see you when they arrive. If you're in a house that's hard to see from the street, consider turning on porch lights, opening blinds, or even placing something noticeable in the window. Now here's something many people never think about. Prepare a small bundle of medical information that's easy to grab. If you can, gather a list of your current medications, your medical history, especially if you have high blood pressure, diabetes, or have had a stroke before your doctor's contact information, and names of loved ones to notify. Keep it in a folder or on your phone where responders can access it quickly. If you're cooking when symptoms begin, turn off the stove. If you have pets, secure them in another room. Dogs, cats, even birds can become frightened or protective when strangers arrive. That energy, while understandable, can interfere with urgent care. And here's something you might not hear in a typical medical brochure. Make yourself visible. If you collapse behind a bed or couch, it may take longer for someone to find you. If you can, position yourself near the front door or in a central room. Clear a path if possible. Move small furniture or objects that might block equipment. Make it easy for paramedics to reach you, treat you, and move you safely if needed. These may seem like small steps, but together they save minutes. And in stroke care, minutes translate directly into brain function. You don't need to do everything perfectly. You just need to do something, a small action that tells the world, I'm here, I need help, and I'm ready to receive it. Because when that door swings open and help walks in, you'll be one step closer to the care and the recovery you deserve. And while you wait, there's one more thing you can do to protect yourself further. Position your body in a way that supports your brain and keeps you safe until help arrives. That's where we're headed next. When a stroke hits, your body may feel like it's no longer under your control. Weakness, dizziness, or numbness can make even sitting upright a challenge. But how you position yourself in these moments could actually save your life. The goal is simple: avoid injury, protect your airway, and give your brain the best chance to stay stable until help arrives. If you're feeling dizzy or weak, don't try to walk it off. Sit or lie down immediately. Many people collapse trying to reach a phone or open a door. But a fall during a stroke can cause head trauma, bleeding, or broken bones and complicate everything that follows. The safest position, if you're alone and conscious, is to lie on your side, preferably your stronger side if you can tell. Bend your top leg slightly and let your bottom arm rest under your head like a cushion. This is called the recovery position. It's taught to first responders around the world because it helps keep your airway open, reduces the risk of choking, and prevents you from rolling onto your back if you lose consciousness. If you can, place a small pillow or towel under your head to keep it slightly elevated. For some types of strokes, this gentle elevation may help reduce swelling in the brain. But don't strain yourself trying to get perfectly positioned. Comfort and safety come first. Here's something that surprises many people. Do not eat or drink anything. I know that sounds harsh, especially if you're feeling lightheaded or thirsty, but strokes often affect your swallowing reflex. Even a sip of water can go down the wrong way and cause choking, or worse, aspiration pneumonia later. Eating also complicates treatment, as some emergency medications and scans require an empty stomach. Also, loosen anything that restricts your breathing. Unbutton a tight shirt collar. Loosen your belt or waistband if it feels constricting. And try to stay warm without overheating. A light blanket is fine, but avoid heavy layers that could raise your body temperature too much. And perhaps most importantly, try to stay calm. I know that's easier said than done. Your heart is racing. Your body feels strange. And the silence in the room can be terrifying. But panic raises your blood pressure, and in the middle of a stroke, that can make things worse. Take slow, steady breaths. In through your nose, out through your mouth, one at a time, just like we do together in the clinic. These small choices, your position, your breath, your focus, might seem insignificant in the moment, but they create stability. They give your brain a chance to hang on just a little longer. And in a race where every minute counts, that might be just enough. Now, while you're lying there, there's one more critical thing you can do. It's simple but powerful, and it could shape the treatment you receive when help finally arrives. Let's talk about that next. While you wait for help to arrive, there's one more step you can take. And though it doesn't require strength, speed, or technology, it can make a real difference in how doctors care for you. That step is this: pay attention, notice what's happening in your body, and, if you can, track it. One of the most important pieces of information stroke doctors need is the exact time your symptoms began. It determines what treatments you're eligible for. There's a medication known as a clot buster that can restore blood flow and limit brain damage, but only if it's given within a specific window of time. And in many cases, that window starts the moment your first symptom appears. So try to recall the time when it all began. Was it just after you woke up? Right before lunch? If you can reach your phone, open the clock app or write the time in a note. If you can speak, record a voice memo, even a single sentence, like, "My left arm went numb at 2:15. If writing is hard or your hands won't cooperate, just keep repeating the time in your head. Anchor it. That number could shape your entire care plan at the hospital. Beyond time, notice how your symptoms are changing. Is the weakness staying the same? Is it getting worse? Are new symptoms appearing? If so, what are they? Keep mental track of how your body feels, even if it's just in broad strokes. And here's something many forget if you've taken any medications recently. Try to recall what and when, especially if you use blood thinners, blood pressure pills, aspirin, or pain relievers. These can all affect the kinds of treatments doctors can safely give you. If you still have the presence of mind, set an alarm on your phone to go off every few minutes. This might sound strange, but it serves two purposes. First, it keeps you oriented, reminding you that time is passing. Second, if you begin to drift into unconsciousness, the alarm may help alert responders or neighbors if the volume is loud enough. These small acts, recording time, tracking symptoms, staying aware, don't just help doctors. They help you. They ensure that when help finally walks through your door, you're not starting from zero. You're already part of your own care team. And sometimes, that's the difference between just surviving and making a meaningful recovery. But your journey doesn't end when the ambulance arrives. In fact, it's just beginning. Because what happens at the hospital and in the days and weeks that follow will shape the road ahead. Let's take a look at that next. The ambulance arrives. You're on your way. For many, that feels like the finish line. But truly, it's only the beginning. The moment you enter the emergency room, a second race begins. This one is against swelling, bleeding, clotting, and time-sensitive decisions that could shape your recovery for years to come. The first goal is clarity. Doctors need to know, is this a stroke caused by a blockage or by bleeding? That answer determines everything. A CT scan is usually the first test done. It's fast, painless, and reveals whether there's bleeding inside the brain. If the scan shows no bleeding and your symptoms started recently enough, you may be eligible for a clot-busting medication, something called alteplase or tenecteplase. These medications dissolve the clot and help restore blood flow, but they're most effective within 3 to 4.5 hours from the start of symptoms. That's why every minute matters, and why the time you tracked earlier can change everything. If the stroke is caused by a larger clot, you might be rushed to a specialized center where doctors can perform a procedure called mechanical thrombectomy. They guide a small device through your blood vessels and physically remove the clot. It sounds extraordinary, and it is. And in the right hands, it can restore movement, speech, even independence. But even with fast treatment, the journey doesn't stop at stabilization. The next phase is healing, and it's just as critical. You may need physical therapy to regain strength, occupational therapy to relearn daily tasks, and speech therapy if your ability to communicate was affected. Some people walk out of the hospital in days. Others take weeks or months. There's no one timeline. Recovery is as personal as the brain itself. What matters most is starting early and not giving up. The brain has an incredible gift plasticity. That means it can reroute and rewire. It can adapt. It can grow. And yes, it can heal, even after trauma. But it needs practice, repetition, support, patience, and belief. In this stage, your attitude becomes part of your medicine. Hope becomes part of your rehab. And every small victory, lifting a spoon, saying your name, walking a few steps, is worth celebrating. You may feel vulnerable. You may wonder if life will ever be the same. And the truth is, it may not be. But different doesn't mean worse. With the right care, support, and mindset, many stroke survivors go on to live rich, meaningful, deeply fulfilling lives. Of course, there's something even more powerful than fast treatment, and that's not needing treatment at all. And that starts with prevention. If you've made it through a stroke, or even just come close, you begin to see things differently. You realize that the true miracle isn't in the ambulance, or the hospital, or even the medication. The real miracle is prevention. Because the best stroke is the one that never happens. And the truth is, most strokes are not random. They're the result of silent damage building up over time, often from things we can control. High blood pressure, high cholesterol, diabetes, smoking, a sedentary lifestyle. These are not just numbers on a chart. They are risks that stack up silently until one day they don't stay silent anymore. The good news is that prevention doesn't have to be overwhelming. It doesn't require perfection. It begins with awareness and small, steady changes. Start with blood pressure. It's the single biggest risk factor for stroke. Many people walk around with numbers far too high and don't even know it, so check yours regularly. At home, at the pharmacy, at your doctor's office. And if it's elevated, don't ignore it. There are medications, yes, but also lifestyle shifts that make a big difference. Less salt, more leafy greens, a walk after dinner, a better night's sleep. Next, pay attention to your heart. If you have atrial fibrillation, a common irregular heartbeat in older adults, it can send clots straight to your brain. It often doesn't feel like much. Maybe a flutter. Maybe nothing at all. But it raises stroke risk 5-fold. The right blood thinners can lower that risk dramatically. And of course, let's not forget the basics. Keep your cholesterol in check, reduce processed foods, limit alcohol, and if you smoke, please, stop. Your brain deserves better, so do your lungs. So does your heart. Exercise doesn't mean running marathons. It can be as simple as daily walks, light gardening, or Tai Chi. Movement keeps blood vessels flexible. It calms stress. It improves sleep. And it reminds your body that it's still capable. Even technology can help. Smartwatches, medical alert devices, blood pressure monitors, and fall detectors can all play a role, especially if you live alone. And then there's the power of routine. Make checkups part of your calendar. Ask your doctor for a personalized stroke risk assessment. Don't wait for symptoms to show up by then. It's often too late. Prevention isn't just about avoiding death. It's about preserving independence, protecting memory, staying in control of your life for as long as possible. Because stroke doesn't just take away movement. It can take away your ability to speak, to connect, to recognize faces you love. But when you choose prevention, you choose to protect all of that. You choose to live with intention. And if that sounds like something worth fighting for, you're already on the right path. Now there's just one final message I want to leave you with. If there's one truth I've learned after decades of treating stroke patients, it's this. A stroke may interrupt your life, but it does not define your story. Whether you've been through one, lost someone to one, or simply fear it might happen to you, you are not alone. Millions of others are walking the same road, facing the same unknowns, searching for the same strength. And strength doesn't always look like standing tall. Sometimes it looks like remembering a number, making that call, unlocking a door, breathing through fear, choosing to fight even when your body feels broken. The fact that you're here, that you've made it to the end of this message, means you care about your health, about your independence, about your life, and that's something worth honoring. So, here's what I hope you remember. You have more power than you think. You don't need to wait for someone else to act. You can prepare, you can respond, and you can prevent. Because when a stroke strikes, what you do in those first 5 minutes can change everything. Not just for survival, but for recovery, for quality of life, for the years that follow. If this video gave you clarity, confidence, or hope, I want to thank you for spending your time here with me. It means more than you know. And if you believe this message could help someone else, someone you love, someone who lives alone, someone who needs to hear that they're not powerless, please consider giving it a like, sharing it with them, or leaving a comment below. Your story might just be the reason someone else survives. And if you'd like to learn more about how to care for your brain, your heart, and your body as you age, I'd be honored to have you join this growing community. Just hit that subscribe button so you don't miss what's coming next. You deserve a life of strength, clarity, and peace, and it's never too late to protect it starting today. Thank you for watching. I'm Dr. James Porter, and I'm grateful you're here.